knowing and celebrating the success of our TRICS 2 candidates. And the candidates we have all introduced before also. The first one, Dr. Aarti Kabra, Dr. Estraj Ul Arifin, Dr. Ria Malhotra. Now, I would be starting with Dr. Aarti. I would be taking 5 minutes of your time, Dr. Aarti, followed by again 5 minutes from Dr. Arifin and Dr. Ria, 5 minutes. And I would be expecting some of your feedback and some of your the preparation strategy. The questions would be different because the candidates they have expected some of the things that we thought maybe the trainees who have tasted the success they are the best person rather than we are the faculty would be again explaining everything. So Dr. Aarti, I would be requesting you to share your experience. Two questions from my side. First of all, what was your biggest challenge while preparing for edic 2?
I mean, there were like many challenges. The biggest was the knowledge gap. So it was like there was a lot of gap between EDIC 1 and EDIC 2. So because the slot is not easy to get. So after EDIC 1, there was preparation was there theoretical, but later because the gap was there, so that was one. So it's kind of because you cannot go through the whole textbook or EDIC ESICM modules. So to summarize all the bread and butter topics of critical care, that was essential. And the second was communication, because in like real life, I am an introvert, so I don't talk too much. So this
Hmm.
exam needs like a lot of communication, a lot of speaking. So sometimes you know also some of the things, but it doesn't come out very instantly, and it
Agree.
needs a lot of practice. So
Yeah.
these things,
Yeah.
yeah.
And the second question I would be expecting from you, one preparation mistake, because success strategy people normally shares and there are a lot of repetitions, but mistakes that you expect that candidates should avoid who are actually preparing for the next season.
I think I mean, there are many mistakes I have done in retrospect, I think, not like one or two. But the first thing is passive reading, like going through the textbook passively. It is like you have to quickly summarize that topic and keywords of that bread and butter, like shock, ARDS, mechanical ventilation, tracheostomy, hemodynamic monitoring. All these are very essential topics. So one has to know the key points, keywords, and have to read kind of and actively recall and keep repeating. Then only you remember those in a long term. And starting early, because you if you have an advantage of 4.5 months of preparation, so from beginning. And I always used to remember this one word from Dr. Tapas: high voltage exam. And when I we actually appear for this exam, it really feels like a high voltage shock, because questions comes like even in CCS the questions are very rapid. You feel like you have got 10 to 15 seconds of thinking time, and you have to answer like 3 points in that, and very specific pros and cons. They are very common: pros and cons, what are clinical predictors, what are clinical parameters of whatever, like weaning is a favorite topic. So a lot of these. And these are the things which I feel like mistakes are. You asked me mistakes. So
Yeah,
one is
yeah, yeah, yeah,
passive learning. See, so passive learning is like just read, and then don't remember. So you have to
yeah.
communicate. The only way is like read the topic, teach or discuss or talk to yourself, actively recalling and every point. And the second mistake is mock exams, like I mean, not one or two, but many mock exams are needed. Like somebody asking you there are a lot of cases or CBS circulating because of after these exams, so many exams. So
Mhm.
they have to be somebody need to ask your colleague or senior or your. So you have to appear for these mock exams.
Yeah, so I
And
think that's why TRICS 2 would be very helpful. where like lot of exam preparation and mock tests, weekly tests, everything would
Yes.
be very coming handy. Yeah.
I mean, you
Thank-
need to have some broad structure, which actually
yeah,
this course provides. Because once
yeah.
you lag behind or slow down, immediately when debrief comes or this comes, and you again start getting interested. So that is one thing. These are the
Thank
things I think I missed.
thank you, Dr. Aarti, for guiding the young trainees for the upcoming season. Yeah.
Yes.
Best of luck for your future endeavors, and please stay in touch. Yeah.
Sure, sir.
So, yeah,
Thank you.
thank you. Now I would be coming to Dr. Arifin, the silent, I would say, and very sincere, the trainee, or I would say the member of our Tricks 2 course. And we were very sure that he would clear it. So I would be asking you a very different question, Dr. Arifin. It would
Yes, sir.
not be your tips or tips and tricks. Rather, I would say that what would you do differently if you had to prepare again? Now you don't have to prepare, so forget about that proposition. But I am giving you one imaginary no, the thought process, so that the trainees would be benefited. Now you have tasted success, but if it would have been something different, then and you have again decided to appear the exam, the November session, so what would have been your approach?
Now, the one thing which I missed and I thought that I would have done better was to prepare for the surgeries, the major surgeries which end up in ICU, and they what these surgeries are, how they are being done, and what complications to anticipate. This was a problem which I faced there. Anyway, I got through because I stayed safe and always keep this thing that I have to follow A, B, and C. But the thing which I missed was that anesthesia and the major surgeries with their complications. I think we have to. I have to put more stress on this thing. This is more important.
Thank you very much. And the second question, how did Tricks 2 actually help you in handling the difficult scenarios, the exam stress?
First of all, the modules. I did almost all the modules, and I did previously as well. So it was very helpful. The questions and the way they were asked was very close to it, and so you have to formulate the answers. And the other thing was it covers up almost all the basics which is required in the critical care exam. So this is why it was very helpful for me. And last 20 days, I just follow this trick. Just follow this trick modules, and I repeated it, revised it, and act accordingly. Just this.
Thank you. So the last 20 days, your strategy actually worked. The tricks actually worked. Yeah. Thank you very much, Dr. Arifin. And
Professor,
again, we wish all the best. Yeah, yeah, please.
Sir, I just wanted to,
Yeah, yeah, please.
talk about Test Raj.
Yes.
So, congrats, Test Raj, for you clearing the exam. And it is no surprise for us. As Professor said, we all knew that you will definitely clear the exams. Because if you see, I was just looking into we usually score the students when we take mock exams. I have written a feedback for you. So, I have written very, very good. So, that means you have done exceptionally well in your mock. So, we were not surprised when you cleared this exam. So,
Yeah, exactly.
congratulations and do keep in touch. All the best for your future.
Thank you, sir.
Thank you, Dr. Jitendra, for sharing your feedback before the real exam also. So that was something which clicked. Yeah. So and last but not the least, our I would say the golden girl, Dr. Ria Malhotra. I would be keeping her in very high position because she was in touch for different exam preparation for last 1.5 year to 2 year, if I remember, or more than that. So Dr. Ria, many congratulations. Now you are in a different league. So one thing that I would be expecting from you, different from the other previous questions, how did you structure your daily or weekly study plan? Because this is something every candidate's biggest fear. How you would be managing time for this type of high voltage exam?
So, firstly, thank you for giving me this opportunity to speak on this platform. Firstly, it was very difficult for me to keep a daily schedule or a daily routine for practice because of the hectic duties, both in critical care as well as in emergency room. So, my strategy towards the end of the exam, and that is my advice to all the students, that I had fixed a couple of hours every day where I used to go through the modules of TRICS. I used to go through the recorded sessions time and again. The very little details that Sanantha sir, Jitendra sir, and Tapas sir have highlighted have really helped me, and I got the confidence to present important cases at the bedside. So please make yourself habitual to present cases at the bedside. It really helps. Presenting ABGs, presenting X-rays, CT scans with your seniors, with your peers, it really helps. And the platform that I got, the type of exam the type of answers that they want, I had no idea about it. I had no idea what EDIC 2 is about. But because of this platform of TRICS, I got an idea what the examiners want from you. And that is most important. So please keep revising daily. Keep the consistency going and practice images because the time given for CBS is very less. The images go away and they change the images, and sometimes it is difficult to come back to the previous ones. So thank you, TRICS, for giving me this platform and making my base stronger than what it was.
Thank you, Dr. Ria, for making us proud. We are really right now, keeping you in the top 10 performers in our course. And last but not the least, I would be taking 30 seconds from you. Keep it short. What surprised you the most in the real exam? Something you definitely feel this exam is really difficult or different.
So this time, as compared to the last, the images were different. The clinical case scenarios, when if I start from clinical case scenarios, they kept asking what else. So their list of answers was huge. You were expected to say everything. What helped me the most was number one, airway breathing circulation. Number two, always go back and reassess your patient. Always do that. That is very important. Number three, involve your seniors, your consultants, and form a team. Regarding the CBS stations, so what was most difficult was that the time was very short, and it was a one-day exam and there were 3 CBS stations to complete. So the time was very limited. This was what was very stressful this time.
Yeah, thank you, Dr. Ria, for those helpful tricks and tips. And we wish you all of you three all the best. And anything from Sanant or Jitendra or Niharika at the end, maybe 1 minute, then we will be concluding. Okay. So with this, I would be taking the proceedings forward with Dr. Niharika. Please share your screen, and we would be having our first domain, that is the ABG. And in the meantime, thank you, Dr. Ahmad. Thank you all the successful candidates for joining us, and we hope to host you in future as well.